Hi. So I'm going to try to record this and make it kind of a little bit of a video, so you can just, watch it. But I got this interesting, I got pinged from somebody that was asking a good question, and it says, can somebody eloquently explain Florida's COVID-19 numbers? Please share how to read the data and where they get the data from. So many do not know how to interpret the data. Many feel we are open. Since we are open, we are safe because trusting the state would be closed otherwise. And there's an article that says 55,000 new cases were reported in Florida today. So the first question is where, how to read the data and where to get the data. So there were some kind of, possible answers or already to this, but and everybody always says that they're getting the data from Johns Hopkins Resource Center. So this is where they do some visualization of the data. But it'd be nice to read in the data ourselves. So kind of looking for a way to download the new cases. So we can choose a state, and this is June 9th, 13th, and this is Florida. And in the background it says increasing versus decreasing. Green is decreasing, red is increasing. So we're kind of increasing here. But it would be sure nice to, and then this is a 3-day average. So one interesting thing, because I don't see a CSV file or any data to download. So before actually looking at that, Kaggle is where a lot of the data scientists go, and that's kind of like the main section. And you can go to data sets, and this one has been up like 825 times, and so this has a county-wise data set. And say we want to download so it came in a zip, and so I'm going to add, I want to add the Excel to, so here's the Excel data, and So it gives us a date, and it says country. And looking at the data, it doesn't really give us county-wise. At least I don't see. So this says you can jump down. So this has 502,000 rows of information, and so I don't see a column that says county, so I'm gonna, and one data set that I like is this. It says COVID-19 data, and I'm gonna pull up another window capture of the Git bash. Okay, so this is, I opened to the COVID-19 data. I had cloned it on my computer, so I can pull the data from, this is from the New York Times, and so what this data looks like, I just pulled it, and it has counties, and I think this has Excel on here, but here's the county in Washington. This has 264,000 rows, and it says cases and deaths. We can let me see if so I'm going to add a display or new window. I'm going to capture VBA. Okay, so I'm trying to not hide the data. Okay, so I can write and go through each line of this data. It starts on, let me get rid of the Git bash lower. It starts on row 2, and we can do exactly what we did. Is you can press Control down to see how many rows that is. We want to get the row. So whenever we check, we get the 264,000 rows that we had previously. And we want to go through each row, and we can check if the county, which is in cell B, is Brevard. And what do we want to do if that's the case? It'd be nice if we saw how many cases there were and what the date was, and possibly the deaths. And so we can make, possibly we could just output it onto a new line just with county specific So I'll keep track of and we want to do the date, which is in row A. We want to do the cases, which is in row E, and we also want to output the deaths, which is in row F. After we do that, we want to go to the next row. So we could run this. And we get to the first instance where range B1 equals Brevard, and so we're going to output the date, the cases, and then the deaths. And Excel has date as a number, so we can convert that later. And to me, we can rerun the whole. So what we just outputted is the and this is a date. So this is when Brevard got its first case, and that was March 17th. And we can visualize this data. So here's the Brevard. And the death count has stayed low in Brevard, but it may not be good to put it on the same graph since, but we could possibly add it to a different secondary axis. So we want to change chart type. And we want a combo, and this wants to be a secondary axis. So on the right side, it'll show the total deaths, and on the left side is the case count. And so Brevard is going up to 17 deaths, and here's the total case count. The problem with this data is it seems like the more important question is new deaths or new cases. So you can try to figure out that information by just taking the change of so this is cases, change cases. I want to write a delta, so insert we want a symbol, we want a delta. So here's our delta in cases. So this one just equals 1 because it was the first case. So each one there was a delta or change of 1, but this was the first time that there was a change in 2 cases. So we can collect that data. Then we can say we want the change of deaths. So here's the first time that we had a death. So that just equals that number. The rest of them and a lot of times let's see if this is being I'll get rid of let's see here, we want Excel to be above VB. Sorry, here was my I'm new to visualizing this stuff. Okay, so we have total deaths and total cases, but really the change is kind of the more specific, or thing that's interesting, because you want to see if it's growing or shrinking. So I'm going to push down that visual. And then the other important thing that we want to look at is like a moving average, because you want to see a 3-day moving average. And what you can do is you can start at this number and I've got 2 parentheses and it fixed it. So the change in cases, right here we have 4, so 4 divided by 3. Here we got 5, 5 divided by 3. We can bring so a lot of times this is where you'll see the line. So what we want to do is we want the date and we want the change in cases. We want to create a bar chart. But we also want to select, we want to add a 3-day as a line graph. Chart type. My Excel's thinking. But the change in cases, you definitely can kind of see that Brevard was sitting kind of low, and when reopening was occurring, it seemed reasonable, just based on changing case count. But within the past 2 weeks, it just looks like there's a lot higher case count. So my computer's kind of, Excel's running out of juice. So while that's waiting, I may go to my other thing, which so I want to go to something I already was working on. Get bash. And we want to open Jupyter. And so I'm opening that same data set, and I can take this and I want a new cell. So this is another way to read the data. We can take that and then it shows us what the first 5 rows are. If I do head, you can get it's 264,000 rows in one column. I can let me collapse. clear the outputs. Okay, so we ran the file. We have the data in our data frame, and to me, we can say I live in Palm Beach, but say we want to do Brevard, and we want. So I did a 3-day moving average of new cases, and for new cases I just subtracted the day after, and new deaths. So I don't want new deaths yet because it may jumble the plot. And here's the new cases in Brevard. The blue is new cases. The 7-day moving average is the green that kind of shows the increase in the next. And then let's do new deaths. And we also want to do the moving average of new deaths. And we want to plot that. And says we don't have county. So there's the new the 7-day moving average of new deaths, and the change in deaths in Brevard is still low. The data set is just really small, so it's very granular. I mean, the most deaths in a day has been 2. This changes a lot when you look at Palm Beach County. Where still the deaths over 7 days hasn't increased. However, when you look at the case count, it really is increasing, and the big question to me is, are these cases going to turn into deaths? A lot of times you look at a lagging indicator of deaths, so that's the concern, is that these cases over the last 2 weeks will turn into deaths. I'm just going to, I know I'm kind of all over the place, but I'm going to jump over to, this is the dashboard in Florida. And we can go to Brevard. And I like this reopening criteria because it kind of shows, this is a weekly, so as 6/13, 6/6, and it shows the increase in case count. The other big question to answer is, is it just because of testing? This has the lab positivity rate. So if you're increasing testing, then this will keep going down as the cases stay the same. But if you have an increase both in case count and lab positivity, that means that you have a higher percentage of people infected in the area. So this is a true increase. It's not because they're testing more. If the case count went high and the lab positivity went really low, that would be, you could possibly make the case that it's because of just more testing. But the other issue is under the opening guidelines that the White House they have criteria where it says downward trajectory of document cases over 14 days or downward trajectory of positive tests, flat or increasing. And right now in Brevard, with this up spike of both the lab positivity and also the increased cases, it's cause for concern. And here's the influenza-like or COVID-like. You want a downward trajectory to reopen. Past week, Brevard has failed both of those tests. And then here's the treat all patients without a crisis. It still looks like Brevard has open ICU beds. And so that looks like it's okay. Now, when you look at the data from possibly Palm Beach, you get, that's where I'm at. You kind of get it, more data because we just have more cases in general. New cases per week. Almost 1.9 thousand, and we're steadily increasing, and then our lab positivity is increasing, so it's cause for concern. Another thing, you can go to this section on the data library, and it says this is where her master file is, and it's in JSON. You can query this data, but I haven't quite figured out. I have looked at this data. I've downloaded it before, the case line data, and that's a good spot. I like this. Here's the modeling project for Columbia, and I like this because you can go into Florida, and you can go into Brevard, and you can say what are the daily new confirmed cases. What is the projection? And we can look at, different types of assumptions. If a seasonal change, here, and this is the available hospital critical care beds. Just to me, under no change, this is where, from a hospital standpoint, you're worried that you may run out of beds. So we go to Florida and we go to Brevard, and it doesn't look too bad. It's the increase. It's cause to concern because maybe in August, if nothing changes, then we could run out of. Ooh, I think I lost my webcam. Should I put my webcam up there? Oh, there I am. But Palm Beach County is not doing too well. So there's Palm Beach, and we go to Palm Beach, and there's new cases. It looks like we're on an upward trend, and it looks like we're starting to do okay with critical care beds. A few days ago, that was not as promising. I also like this. We can go to So I could probably download this Excel, but that didn't look like it's up. This is cool. R. These are the R is a statistical language, and I like this one from a 10-day forecast from this is University of Melbourne. We want to do US, and we want to do Florida, and this is where it's caused concern, because this it looks like their projection, we're at 45,000 active cases, and it thinks we're going to be twice that in 10 days. The minimum so that doesn't really sit well, that, you know, this projection from University of Melbourne, you know, thinks that we're growing, and you know, the min and max, you know, it's not very promising. The question to me is, you know, the big question that I don't think these are answering is the deaths associated. Is the daily deaths going to increase? Because right now the deaths is staying stable, and if we can sustain higher case counts and the death be similar, then some, you know, it's, to me, mortality rate is influential data point for policy, but in pharmacy, some of my friends, which make good points, is these hospitalizations or these cases, even if you don't die, right now, hospitalizations, that's well set on this dashboard. So if you go to Brevard and you go to summary and you click, it says that 20% are admitted to the ER, and then 10 inpatient, 10%. So out of those cases, 10% are hospitalized, and that hospitalization is expensive. So, you know, being in the ICU for you know, 10 days can rack up a large medical bill. So that's concerning financially to people. But this puts it really into a good graph, because it has the economic impact of, in Brevard now 15.3% is unemployed. It looks at mortality, how many lives have been lost. You know, is the lives lost, is it worth the economic unemployment and halting? And then it, you know, kind of gives a scorecard on how well social distancing is done. You can click to see how the data is, she's trying to measure that. So it looks at average distance somebody travels pre-COVID-19 days. And it looks at social distancing. So it talks about the methodology. Human encounters would cause, if you're traveling and you're getting closer to other people, you have a higher rate of infecting other people. So anyways, here, I think let's go over to the questions. So that was my take on looking at the data. I guess, I'm still trying to figure it out. How do you interpret the data? 5,000 new cases reported in Florida today. I kind of looked at that both in Brevard and Palm Beach County, like in a more local level. What does that mean? It's just the flu. My initial thought is it's very, there's a couple big differences as the reproduction rate is much higher, so it spreads a lot worse than the flu. And the other thing is nobody has immunity, and we don't have a vaccination. And I think the mortality, just what I've seen is, I think it's like 5 times, that's a ballpark number, more deadly than flu. And it is true that younger people aren't dying, as I would think is true, or it looks like that way, is younger people aren't dying as much. But it's still new, and if you have comorbid conditions, I think in the hospitals, where I work, one statement is that they are seeing young people, and we're seeing now workers that aren't able to social distance. A lot of those types of workers are being, admitted. This more testing, it is true that more testing, you'll find more cases, but if both the both the positivity rate of those tests and the number of tests is increasing, then it can't be the case. It's a true increase. So it depends on, what the positivity rate is, how many actually you're trying to kind of sample and see what the prevalence of COVID in that community is, and if you just test a lot more, then your percentage of positivity would go down. But okay, it's not to say that in a couple weeks, this may be true, but right now, the last 2 weeks in Florida and Palm Beach and Brevard, it's not true. We've all been exposed already. I don't think that's true either from the data. I think the prevalence, what I've kind of seen is that it's maybe I think it's only hit 4 to 6%, possibly, like a ballpark number of the population. So you don't get herd immunity until like 50 to 70%, and I'm not the expert in that, but that's what from me looking at the numbers, I think only a small fraction of people have gotten the virus yet, and that is kind of indicative in the positivity rate, but we still have a long way to go before everybody's been exposed, and that's this line to me can be faulty reasoning because I just don't think that's the case right now. And also, if you don't know, I think you should err on the side of caution. Young enough to most likely fight it. People, in the concern about the Black Lives Matter protests and young people kind of getting together, it's an interesting question to me because, yeah, if you can, if you come down with the virus and you're able to fight it, and then you're okay 2 weeks later and the immunity stays, if the mortality rate's very low and the hospitalization rate for young people that are healthy, is it a chance you want to take you know, and just, but the problem, the issue with this is, are young people going to bring it home to their family members that are possibly older? And then it's not guaranteed that the immunity will last, how long it'll last. And then also, there are, there are cases where young people are being hospitalized or dying. So this logic to me is, it's difficult to defend the logic without saying to be cautious. If it was that serious, the state would not be open. So this is an interesting thought, because it is true that I think the governor and local officials, county commissioners, and have been looking at data pretty seriously, and we were under a close enough, we weren't under a decrease, but we weren't in an increase phase, and it was kind of stabilized or plateaued. So it felt like, it was a different case. But the last 2 weeks with increased case counts makes, my observation of the data is cause for concern. The one big data point that is really promising is the death rate has not increased yet. But that's where, the big question is, well, will it? And do you want to take that risk, or be a guinea pig and see, which it seems like some people, are willing to risk and say, I want to be a guinea pig. But from a public health or population standpoint, it's hard for, I think, politicians to defend or espouse that position. So anyways, that was kind of a go through of some of the data, and I have been looking at the numbers. I'm a pharmacist, and been also training to become a kind of data scientist, so kind of went through the process I would kind of go through. There are some holes in my process, and I'm trying to get better, but I thought that it would be possibly helpful for other people to kind of see how I would go about answering those questions. All right, I'd love to hear comments or feedback, and yeah, all right, sign out.